Hi there, I'm Andrew Getson, Dr. Getson.
Hi, I'm Karen.
Hi Karen, nice to meet you.
Nice to meet you.
What brings you here today?
Well, I made the appointment because I've been having hip pain for about 4 weeks. Right here.
When does this come on? Does it come on by running or biking or swimming?
Well, I've been training quite a bit the last few months. I'm signed up for a marathon in about 2 weeks, and the big race that I'm aiming for is a half Ironman in Providence in July. I first started having pain running, pretty much when I was done running, and then it's progressed so that when I'm running it hurts, and now even when I'm biking, if I'm standing to pedal, it hurts then, and I'm pretty frustrated, and I'm wondering if I should even consider dropping out of the Ironman.
Well, I wouldn't make any decisions yet. Let's talk a little bit more, see if I can get a better beat on this. You have a lot of time from then till now to get yourself ready. Let's see if we can solve this first. What makes this worse? Is it running uphill, downhill? Are you doing any speed work right now?
I live in Ithaca, New York, where it's very hilly, and I first started noticing pain when I was going down long downhills. And now it hurts when I do that, but also running on flats. It got a little worse from speed work too, I think. And at this point, the only thing that doesn't seem to cause pain is swimming.
Have you changed your training to prepare for this? Have you done other marathons or other half Ironmans?
I did a half Ironman last year, and I didn't have hip pain. I actually had pain down in my knee. So this is a new problem. I've backed off on running. I've backed off on biking because of this pain recently.
Does anything make it better, or anything make it worse besides hills?
Well, just sticking to swimming makes it better. Anytime I run, it hurts, and anytime I bike, it hurts. I've tried icing, which I can't tell if it makes any difference. Ibuprofen might help, but it seemed to upset my stomach, so I really haven't been taking that either. So I don't really know what to do now. I haven't been doing really anything to make it better, just not run or bike as much as I feel like I should.
Well, it sounds a lot like IT band syndrome. It's the second most common thing I see in runners. Let me do a brief exam to see if I can get some more information, help reinforce it, and then we'll talk about a treatment plan of how we get you better. So if you'd be so kind, I'm going to have you stand right here, facing that way if you'd be so kind. What I'm going to do first is just examine your back to make sure it's not caused from a disc in your lower back that's hitting a nerve and sending pain down. So if you'd be so kind, I'm going to have you bend forward and try to touch your toes as your comfort level allows. Thank you. Does that give you any discomfort?
It only hurts my hamstrings a little bit because they're pretty tight, but it doesn't hurt my hip, it doesn't hurt my back.
Good. If you'd be so kind, I'm going to have you stand on your left leg, please, if you would. Right. Thank you so much. Now I'm going to have you stand on your right leg, if you would. Not quite steady, is it? You can stand normally. This test is called a Trendelenburg, which is looking to see if you're firing your gluteus medius, which is a proximal stabilizer for the IT band. So if you'd be so kind, I'm going to have you sit at the table, if you would, facing me. And I'm going to do another test which looks for a disc curl. I'm going to bring this leg up. I'm going to ask you to bring your chin to your chest, please. Great. Does that give you any discomfort?
No.
Good. Do the same thing on the other side, please. Chin to your chest, please. Great. Thank you very much. If you'd be so kind, I'm going to have you lay all the way back with your head right up to the top of the table. And this is the good side, correct?
Yes.
Okay, so I'm always going to use the other side for comparison.
Okay.
But I always tell people, because people always try to direct me to the other side.
Okay.
So if you would, please, I'm going to have you make a muscle real strong, if you would. Make a pencil. I want you to make it nice and straight and bring it straight up towards the ceiling, if you would, please. Awesome. Great. Maybe push it straight down, please, if you would. Real strong. Great. Maybe push out towards me. So the whole leg out. Yeah, excellent. Thank you. And bring it towards your other side. Excellent. Good. And that doesn't bother you at all. Stabilizing this side to test this side. Correct?
No.
Right. I'm going to bring you up a deflection. All up into twist here. This test is a test to see if there's a problem within the hip itself, which could be something such as a labral tear or arthritis. So right. Now bring this leg all the way up. Awesome. You can probably keep going. Great. If you would please, I'm going to have you grab both your knees up to your chest. I want you to bend all the way up if you would. I want you to hold it real strong. I'm going to pull onto this one, please. And have you let go of this side, if you would please. Great. Awesome. And this is a test to see how tight your hip flexors are. They look pretty good. Bring both legs down, please. We're actually going to bring them up one more time, if you would, please. Great. I want you to switch it onto your other leg, please, and let this one come on down. Awesome. Great. You can straighten them both out, please, if you would. Over the other side, yeah. Great, we're going to do the same thing on this side if you would. If you would, I'm going to have you bring this leg right up towards the ceiling. Awesome, good, good, good. I want you to push straight down, please. Great, I want you to bring it out towards me if you would. Thank you. Bring it towards the other side. Great. I'm going to bend you up like this, all the way into flexion. Twist you over here like this, twist you like this. That's okay? Mm-hmm. Does it give you any tightness over here a little bit?
It stretches it out a bit. I feel that.
Okay. Right. I'm going to bring you over to this side, so I want you to lay on your side, facing that way, please. Thank you. I'm going to ask if you would bring both your knees right up to here if you would, Karen. Thank you. I'm going to put a hand over this bony prominence here and bring this leg back. And this is called an Ober's test. We look to see how tight that IT band. Try to relax it the best you can. So your IT band is pretty tight. Ideally, I'd like this leg to be able to drop below the table. Great. I'm just going to press and palpate on the area. Any discomfort out through here?
Not really, no.
If I work my way up here, let me know if I'm causing any discomfort.
That's pretty sore.
Right through here, huh? It's usually the bullseye spot.
Yeah.
Are you getting snapping or clicking when you run?
When I stretch, I feel clicking in my hip, but not really there.
Okay. I'm going to have you come on down if you would, please. I'll have you stand right here if you would, facing me. Thank you very much. If you would, please, I'm going to have you stand on your left leg first, if you would. Have you jump it down a few times on your left leg. Any discomfort?
No.
Now have you do it on your right, please. Bother you at all?
A little sore.
Not.
No.
And that's called a hop test. It's a pretty simple test. It's a test to see if you have a stress fracture really anywhere along the kinetic chain, whether it be into your foot, in your shin, up into your femur, and all the way up into the pelvis and hip. So why don't you have a seat? Why don't you sit at the table, and I'll sit here and we'll talk a little bit more. So this problem is very consistent with IT band syndrome. It's one of the more common problems I see in my practice that affects runners. And I think that often when you look at the IT band problems, it's usually caused by a combination of two things. One is caused by poor biomechanics, and it's always that in a combination of doing too much too soon. Now look at your biomechanics, they look very good. And actually a lot of people get very worried about their biomechanics. And the reality is, no one's biomechanics are perfect. But the better one's biomechanics are, the more aggressively they can increase the stress they're putting on their body. And I think this can do very well. People often get pretty bummed out, but I always try to reassure people, look, if you're never getting injured, you're probably not trying hard enough, because you need to put that stress on. When you think of training, here's your set point. You want to put that stress in the system, and if you put a relative rest, you want to adapt to a higher level. But there's that fine line, where if you stress below that line, you'll still physiologically adapt and wind up in a better state. If you stress beyond that line, that's when you get injured. And the reality is, you just missed a little bit. Okay. So, it's not horrible. When we think about that IT band, the main role that IT band is, as we're running, that IT band prevents our foot from adducting too far across midline, and we need to stabilize that by contracting it. But the first line of defense are the core muscles. So the deep pelvic floor muscles, the low abdominal musculature, that's the first line in the gluteus medius. But when they fatigue, that IT band gets overworked. Mm-hmm. And IT band's a fibrous band of tissue. It takes its origin from part of the gluteus muscles through here, part of the muscle up front called the tensor fasciae lata. It goes along this bony prominence here, goes along the out aspect of the leg, and goes to attach into the tibia. And as that IT band gets overworked, it tends to get tight. Mm-hmm. And when it gets tight, it becomes a little dysfunctional. And what it does also is it smushes a little fluid-filled sac there called a bursa. And it becomes this vicious cycle where the body...
So do I have a bursitis?
Well, the bursitis is involved, right? So that bursa is inflamed. And I think that's where sometimes some of my colleagues might miss the boat when they just call this a bursitis. And the reality is, this is your core muscle a little fatigued from overtraining. The IT band then tightens up. It smushes that bursa. When that bursa gets smushed, it tends to secrete fluid to get larger. And remember that IT band's already tight, so now it's going to go farther to get around the area.
Okay.
And then it kind of creates this vicious cycle. So when we talk about treatment for it, part of it's going to be involving backing down a little bit of your training, try to take the load off of it. And the biggest load is downhill running, running with that camber of the road when you have that rain drainage to the side of the road, and then also doing speed work on tight tracks. So those are three things that we know particularly aggravated. In addition, the greater the intensity of running, the higher the speed, if you're doing speed work, the more it's overworked. And then it can be progressive, obviously involve biking. So treatment is multifactorial. It's going to involve backing down your training. It's going to involve some physical therapy where they'll work with you on stretching that IT band. Some people like to use foam rollers to put over that area, and that can be helpful. In addition to that, I'd like you to ice that bursa. So put a little ice right in that spot, get that swelling down.
Okay.
I'm going to prescribe an anti-inflammatory to help calm it down as well.
Is the physical therapy just stretching, or is it to help with my core also?
Well, that's a great question, right? So it's going to be a combination. So physical therapy is going to be targeted on teaching you how to turn those muscles on more proximally, so you're unloading and the forces are being sent and dissipated more proximally. But they're also going to work with you on getting your IT band more flexible, because again, that's sort of the end result of the IT band is really tight. Now, so to be a little more specific about running, I'd probably take a week or two off running. People often get very nervous when they say, oh, I can't run, because they get that program and they get locked on. But the reality is, I'd rather you go to your event slightly undertrained and healthy than overtrained and injured. And I think that by backing down a little bit and running, biking without biking the hills, not standing on off your saddle, emphasize your swim. If you want to go do some running drills to make sure your form is good, that's fine. Some people really want to be running so you can run in the pool if you feel the need. I would expect, based on your exam not being that bad, that you feel pretty good in a week or so and you can ease back into running. Now, people always say, well, what does that mean, easing back in? And it really depends on your comfort level. So some people feel if they start up again and they get more pain, they're going to be crushed and really upset. Other people want to roll the dice and be a little more aggressive and push it. So it's a little bit up to you, but I generally recommend starting back at 50% of your volume, about 50% of your intensity, so really dialing it back. Now, I want to see you back in the office in about 3 to 4 weeks. If you're not getting better, there are other things you can do. Probably the next step would be an injection, or I'd put a little bit of steroid right into that burst to try to shrink it right down. The risks are pretty low. It's usually of all the injections I do, it's actually my favorite injection to do. My patients always kind of laugh at me when I say that, but the reason is it's not painful, it's usually quite effective, and the risks are pretty low.
Okay.
So, I hope this helps. It's a pleasure meeting you. All these videos that we put together are more of a guide to help you if you're having problems while training. But we want you to understand that everyone tends to get better at their own rate, and not everyone's clinical picture fits nicely into one of these categories. We encourage you, if you're having any of these problems, that you think about it, but more importantly, that you get an appointment to see a physician or clinician who understands the treatment of people who participate in triathlons. And really don't take these videos word for word, because everyone's different.